Good morning, everyone. Assalamu alaikum. This is Abdulla Bawazir, internal medicine resident at King Fahd Medical City. Inshallah, today I'm going to speak about our study titled with Evaluating Per-Oral Endoscopic Myotomy outcome based on the Icarded symptom score in patient with achalasia retrospective tertiary center experience in Riyadh, Saudi Arabia. So achalasia is esophageal motility disorder characterized by loss of esophageal peristalsis and with failure of lower esophageal sphincter relaxation. And BOM was introduced at 2008 initially, and then was modern therapeutic technique to treating patients with achalasia, aiming to elevate lower esophageal sphincter pressure and allow peristalsis or allow a sufficient food passage. So we aim this study actually to evaluate the efficacy of POEM procedure in Saudi Arabian cohort based on the Icarded score, and clinical improvement was defined by Icarded score of 3 or less after 3 months from the procedure. And study design is retrospective study, single center in King Fahd Medical City with study period of 6 years that enrolled 115 patients, and we included patients aged above 14 years old with achalasia, all types of achalasia who were treated with POEM in King Fahd Medical City within the study time frame. And we excluded actually patients with prior esophageal surgeries, gastric surgeries, and also esophageal abnormal structure and large hiatal hernia exceeding 3 centimeters. This table actually showing patient characteristic with median age of 38 years, and 3/4 of patient was diagnosed or were diagnosed with type 2 achalasia, and 22% of them were having type 1 achalasia, and followed by type 3 achalasia, only 2.6%. This box plot chart showing that there is significant improvement of median post-POEM Icarded score 1 compared to the pre-POEM Icarded score of 6, and that was statistically significant with clinical success of 84%. And subgroup analysis showed that no significant outcome based on achalasia subtypes. And the independent factor for procedure success, where we found that in our study that had patients who had higher BMI and low pre-POEM Icarded score having more rate of success, and that was also statistically significant. From the study strength, this is from first studies that evaluating a POEM procedure in achalasia patient in Saudi Arabia, and relatively included a more number of patients, 115, and also used the well-validated standardized method of evaluating clinical improvement in achalasia patient, which is the Icarded score. And as the study, due to study design and study protocol, this was the study limited by many means, of which single center study, single arm study, and retrospective study with short time for follow-up, and lack of data on post-operative adverse event and complication. But in conclusion, actually POEM showed improvement in patient, significant improvement in patient symptoms post-procedure with that clinically and significantly clinically observed. And thank you.